Welcome, everyone, to the American Lung Association and North Carolina Community Connections, presented by Novant Health. I'm your host, Will Lewis, anchor and reporter at Queen City News. A few housekeeping items before we begin. This webinar is being recorded and will be available after the session. Please submit questions to our panelists through the Q&A button. We will do our best to answer all questions at the end of the session. We encourage everyone to complete the survey. This will help us guide us as we create future sessions. Today's discussion will focus on learning about youth vaping. We are fortunate to have experts on today's panel to guide us through this discussion. We'll do a brief introduction of our speakers. You should have received their full bios this morning with the reminder email. With us today are Dr. Mark Chester, Novant Health, Irene McCarthy, Mecklenburg County Public Health, and Michelle Mulvihill, Wake County Public Health. Today, we encourage you to reflect on the information provided by our panelists to provide insight into general lung health and how we can all look to play a helpful role in educating the public about the different lung diseases in North Carolina. So let's open up the conversation with some of your questions submitted during registration from our audience. Dr. Chester, how does vaping affect the body, and what are the dangers of e-cigarettes for youth?
Well, thank you so much for having me on to speak about vaping in teens. I appreciate it. The increase in cigarette vaping by young people over the recent years has really become a significant public health concern. Vaping devices in e-cigarettes are electronic devices that heat a liquid, referred to as either e-juice or vape juice, to produce an aerosol that usually these users will inhale deeply into their lungs. The aerosol contains these chemicals and flavorings that can be directly harmful to the lungs, but also have other serious side effects to the body. The majority of these devices contain nicotine. Nicotine is known to be a highly addictive drug found in other regular cigarettes, cigars, other tobacco products. Nicotine in the adolescent teenage brain, which is immature, it can harm parts of the brain that control attention, learning, mood, as well as impulse control. Nicotine does this by altering synapse generation in the brain. Synapses are connections between brain cells that are formed when a new memory or skill is learned. Okay. In addition, when a teen becomes dependent on nicotine, and then stops using nicotine, the body then has to become used to not having it around. This causes withdrawal symptoms. You see irritability, restlessness. These teens will feel anxious. They'll get depressed. They may have trouble sleeping, concentrating in school, as their body craves that nicotine, okay? You can see how vaping has been associated with many mental health issues, including depression, for this reason.
Thank you so much. I'm sorry to cut you off, Dr. Chester. I know we got a lot of questions to get to. Just when we talk about that, we talk about all the nicotine situations. Irene, how much nicotine are in vapes, and why are we seeing youth become so addicted to these?
Yeah, that's a great question. Well, so there is quite a lot of nicotine in these vapes, and some of the top brands that youth are using include those disposables. So Elf bars, Puff bars, High, Lost Mary, Truly, etc., because they're so allowed to have flavors on the market. And so these disposables can contain up to 5% of nicotine. There's actually a really great graphic from Stanford in their tobacco prevention toolkit, and it shows this graphic of, a pack of cigarettes is about 20 cigarettes. In 1 joule, it is the nicotine equivalency of 37 cigarettes, 1 flume float nicotine equivalency of 363 cigarettes, and 1 Elf bar, which is one of the most popular ones today, the nicotine equivalency is of 590 cigarettes, which you can imagine just what that nicotine is doing to their brain. As Dr. Chester said, it does make those mental health symptoms worse, and they're just going through these disposables within a few days. And then one reason why they're getting so addicted is because of this new salt nic formula. So the creators of Juul found out that when you take freebase nicotine, which is the original formula, and you add benzoic acid to it, it essentially lowers the pH of the product, and it creates what's called a nicotine salt. And nicotine salts allow for higher levels of nicotine to be inhaled more easily. And what that means is that these youth are not feeling that discomfort in their throat, and they might be inhaling more than they realize to the point where they become Nick sick.
Yeah, and that's a big problem with a lot of the youth becoming Nick sick, as we were saying. Michelle, what does nicotine poisoning look like, and why is it a higher risk for teens when it comes to vaping?
Yeah, also a great question. So nicotine poisoning or Nixic, it can have a lot of toxic effects, and it has symptoms such as nausea, vomiting, excess saliva, abdominal pain, sweating, blood pressure, high heart rate, balance problems, tremors, headaches, dizziness, muscle twitching, and seizures, just to name, a few. And these symptoms look really similar to other types of illness, so it's really important when people are being seen for this these issues that it's important to screen for tobacco use as well. And the youth are using these products. They have no idea, as Irene mentioned, how much nicotine that they're actually getting, and the amount of nicotine varies by product, especially compared to the traditional cigarettes that Irene said. They're feeding this nicotine dopamine addiction cycle and forming the hand-to-mouth habit, which is obviously really, really concerning, such as what Dr. Chester mentioned too.
Thanks so much, Michelle. And Dr. Chester, I know Irene and Michelle have talked about this, and we've talked about this addiction. So can we talk about, can using e-cigarettes lead to future tobacco or substance use among the youth?
Absolutely. So nicotine in any form is highly addictive. There's studies that show in the first 6 to 12 months of those using e-cigarettes and vaping devices, that roughly 25 to 30% of those individuals will begin using other combustible tobacco products, cigarettes, cigars, hookahs, compared to just under 8% of those that have never used. E-cigarettes have also been shown to be associated. E-cigarette and vaping has been associated with higher incidence of use of multiple other drugs, alcohol, opiates as well. A third of U.S. middle schoolers and high schoolers that have ever vaped or ever used an e-cigarette have also used marijuana in those devices. So very much so.
Yeah, some troubling stats there as we look at that. And I know, Irene, you with the county and a lot of you guys working together are trying to get this education out. So Irene, how are youth being targeted by the tobacco industry?
That's a great question. I do want to point out and say that 90% of tobacco users start before they're 18 years old, and 95% start before they're 21. So it's no surprise that the industry is targeting them because they want lifelong potential customers, right? And so they use an array of tactics to entice them, one being flavors. So these disposables have a lot of different flavors to choose from: orange, mango, guava, etc. And a lot of these youth actually may have never even touched a tobacco product before these vapes, but the various flavors are enticing to youth, and they've been marketed as healthier, more natural, safer, as stress relievers. So misleading health claims is also another tactic that they're pairing with that. Another tactic is at the point of sale. So price promotions, discounts, those billboards with the lights, advertisements, proximity of those products to the candy section where their eyes meet. So the industry actually spends $1 million per hour at the point of sale alone. Another tactic is using social media, celebrity influencers, sponsoring music festivals and events where they can provide free samples of this stuff, as well as how easily concealed these products can be. So a lot of these vapes look like highlighters, USB drives, pens, other merchandise like hoodies, backpack strings can be taken apart, stuffed animals, bracelets. And so why would adults, right, need to disguise their vapes? So youth are the ones that need to disguise and be discreet because they have to be, opportunistic in their use because they can't use around, their parents or in school, right? And then lastly, retailers near school. So the closer their school is to tobacco retailers, the more opportunity the youth have to access. They might use, a fake ID. They may not even get ID at some of these places. They may have older siblings or friends purchase for them. And so our team actually partnered with Counter Tools, and we conducted a tobacco retail assessment, a convenient sample of 112 retailers. And we found that 70.6% of tobacco retailers were within a half mile of the school in Mecklenburg County. So those are just some of the tactics that they use.
Yeah, that's startling to know that it's so accessible to a lot of the youth that is there. Michelle, can we talk a little bit about how can we get through to the youth to let them know how vaping will affect their future?
Yeah, that's a great question. A lot of people have that question to us as health professionals. And so I think a big thing is that we need to start having conversations that begin in the home or with a trusted adult and those, people who are speaking with the youth, using empathy, creating a safe space, really asking why, discovering the why. Why is a teen using the vape? Where do they get it? Just having the open two-way kind of communication with them. These people need to be learning about their products too, and learning about the short-term health effects, what we know, and then the long-term health effects, which we're continuing to learn more about. Nicotine addiction is not benign. It impacts the brain, the behavior, college workforce readiness, and it primes the brain for addiction and use for other drugs, as has been previously mentioned. And so really finding the balance between being a friend and being a parent or trusted adult is important as well, and setting a good example. We have a lot of resources available to us in the state of North Carolina, as well as throughout the county, about just how to talk to youth about their vaping. And some of those include our colleagues with Mecklenburg Public Health. They have a 10 tips brochure, Catch My Breath as a parent toolkit. American Lung Association has their ACT. I'm going to cover it later though. And then also just the Surgeon General's Know the Risk campaign. So there's, again, a lot of resources out there to have that conversation and how to approach it as well.
Thanks so much, Michelle. Dr. Chester, we want to go back to you because we do know that we're trying to get the youth to stop using these vapes, but when it comes to your practice, what's the best way to treat teens that you see who do vape?
I'm sorry about that. When it comes to treating teens who vape, Michelle just said one of the most important things. It's really important to foster that open communication, approaching each individual kiddo with empathy, understanding in the family, because there's often a lot of controversy in the family, not controversy, tough times going on in that family. And so I always try and keep that communication open, trying to uncover, reasons why they started to vape. Often they're vaping to fit in with their peers. Often they're trying to cope with some stressor or situation in their life that's caused a lot of anxiety. Being open and honest. And so, that way you can really convey the potential risks and the consequences that, can happen with their vaping. And then once we get to that point, where they are ready to quit, that's when we can start to provide, the different support and resources that these guys are going to help me with. And, therapy will look, definitely include counseling, some nicotine replacement therapy, as well as, different support groups and things like that. But it really has to be very much individualized to each child, each teen, and each family that we're working with. So it takes some time. We set aside special, appointments for them.
Thank you so much, Dr. Chester. Irene, what are some of the effective prevention and alternative to suspension programs that schools can adopt?
Yeah, so there are a lot of really great evidence-based, evidence-informed resources out there. So I'll touch base on a few of them. One being Catch My Breath. That's one that we promote from the CVS Health Foundation and Discovery. It's for grades 5 through 12. They have a lot of really great tools involved with that. Under that same umbrella, they have their Be Vape Free virtual field trips, where they have interactive videos, facilitator resources that are super helpful. Vaping Know the Truth is also another one. It's from the Truth Initiative and EverFi. This one is self-guided. It's for middle and high school students as well. Mostly used for prevention, but I had some schools use it for cessation as well, because it does talk about prevention, but also resources to quit. You and Me Together Vape Free is from Stanford. They have elementary, middle, and high school curriculum now. 6 great lessons in the middle and high school, and the last lesson being on cannabis. So if you want some information on nicotine and cannabis, that's a great option. Aspire is also another great, more of a video game format. It's from the University of Texas MD Anderson Center. It's bilingual, it's online, ages 11 to 18. Smokescreen is another video game format. It's from Play to Prevent Lab at Yale, ages 11 to 14 as well. And then I'll also mention briefly that I have worked with Jen Vetter. She's the CMS Health and PE specialist at CMS, and she's a fantastic champion if you ever get to meet her. And we updated CMS's alcohol, tobacco, and other drugs curriculum by creating 2 new mind maps around vaping, 2 facilitator guides, and a supplemental toolkit. And so if anyone has questions on that, I'll be happy to connect with them, but that's also another tool that can be utilized. As well as alternative to suspension. So those were more prevention. There are a few alternative to suspension, just because we know suspension does not work. And so we want to provide that education for our youth. Stanford has a My Healthy Futures. That's a 1-hour alternative to suspension, which is really great. And then ALA actually has some fantastic resources that I want to touch on. So In Depth is free. It stands for Intervention for Nicotine Dependence, Education, Prevention, Tobacco, and Health. And it's an alternative to suspension offered to students who face suspension for violation, right? And so the program consists of 4 sessions, approximately 50 minutes. You can offer it to schools or in the community. It can be 1, 2, 3 meeting sessions, and it's administered by a certified facilitator. Not on Tobacco is another American Lung Association program. It's evidence-based to help those youth quit or reduce their tobacco use. This one is in a facilitated group as well, so in person. It's by a trained and certified adult, 50-minute sessions over 9 to 10 weeks. And what's cool about this one is it also covers, life skills like fitness, nutrition, stress management, and communication as well. Not For Me is self-guided. It's mobile friendly, and it's kind of based off of that Not on Tobacco. But what really is cool is because it is self-guided, so the teens can do it kind of on their own time. And it offers a 6-week program, including 8 self-paced sessions that can be accessed remotely. And then lastly, 2 more things from ALA. They have their Vape-Free Schools Initiative Toolkit. So we know that comprehensive tobacco-free school policies provide that solid foundation and infrastructure, to support alternative to suspension, intervention, cessation. So if anyone in the community is looking to review tobacco-free policies, they can take this brief course, about 15 minutes, and utilize an assessment tool and download those support resources. And lastly, ACT, to address youth cessation, is also from the ALA. It's a 1-hour on-demand online course. It provides an overview for those healthcare professionals, school personnel, community members, conducting brief intervention for teens who use tobacco. And this one's based on the American Academy of Pediatrics Youth Tobacco Cessation Consideration for Clinicians Guide. So highly recommend that.
Thanks so much, Irene. And I know, Michelle, and we talk a little bit about this, and we've heard some of the things that happen in Mecklenburg County here in North Carolina, but can you just talk a little bit more about what the state is doing to increase that availability and access to cessation resources for you?
Yeah, absolutely. So, this is a problem that we are seeing across the state and wanting to really address it, with evidence-based and evidence-informed cessation resources. One big one that's funded through the state of North Carolina is Live Vape Free, and that you can text Vape Free NC to 873-373. And this is a youth texting program. It's a learning experience for teens 13 to 17 that's fun and easy to navigate. And it teaches skills to quit vaping for good. And the youth who are enrolled in this actually have access to a quick coach anytime by texting the word coach to that same number. There is a kind of parent companion program for that. They can go online and basically Google Live Vape Free and learn more about this. And that's another resource to kind of talk about or learn how to talk with your youth about it. Of course, as Irene mentioned, American Lung Association's Not For Me is a self-guided, mobile-friendly, web-based program that provides teens the resources to quit vaping, smoking, or smokeless tobaccos as well. And then the Truth Initiative has a text Ditch Vape to 88709, and this is quitting is the Truth Initiative's e-cigarette text-based quitting program. So teens can join, by communicating via text. We've learned through our years is the texting and the everything on your phone is more effective when it comes to reaching our youth and engaging with them than trying to send them to a telephonic program. Lastly, Quit the Hit is something that the state of North Carolina is partnering with Rescue Agency. It's a cessation support group that educates young people about, how to quit vaping through group chats on Instagram, so meeting with where they are, obviously on social media, and it provides 30 days of online quit support in small groups, about 10 to 15 participants, with some moderation from a cessation coach. And so it kind of is all encompassing. It helps with tough emotions, stigmas, quit confidence, and if they're not able to quit on that first day, then they can kind of, work through their program as well. So it's a really good kind of new innovative way to approach cessation.
Thanks so much, Michelle. And everybody does have their phones with them, parents and youth. So that's a good thing now. And also remember, we will have all the resources mentioned today. We're going to share those in an email at the end of today's session. But thank you for this great dialogue. But let's open up the conversation to some of the people who have joined and our viewers. So they've submitted their questions through the Q&A button. We're going to go ahead and start with Dr. Chester. And just remember, we will try to do our best to get to everyone's questions. We got a lot of good ones here. Dr. Chester, like when we first start out, this is the one question we've seen a lot. Aren't e-cigarettes safer than regular cigarettes?
So e-cigarettes and vaping aerosol, it generally does contain fewer toxic chemicals than the deadly mix of over 7,000 chemicals we know are present in traditional tobacco smoke from regular cigarettes. But they're still not safe. Many of those reasons that we've already talked about in the last 25 minutes. But specifically, the CDC back in 2020 showed 2,800 plus cases of e-cigarette or vaping associated lung injury. And with that, there were roughly 70 reported deaths associated with that. So definitely not safe. We discussed the highly addictive substance, nicotine, and all of its negative effects. And now research continues to go on and show us more of these substances that are being found in e-cigarettes and vapes that are potentially harmful. We just don't have enough long-term research to show the specifics on all of that and their safety. I think one of the big things as e-cigarettes gain their popularity right now is that from reading, there's this big concern about this renormalizing, smoking. And we don't want that to happen given, all the progress we've made over the past many years in terms of declining numbers. That could be really hazardous to everybody.
Yeah, thank you so much, Dr. Chester. That leads right into another question we had. And I'll give this to you, Irene, because you see this a lot. What has been the most successful way to change the environment so that teens do stop vaping, like on school buses and things like that?
Yeah, so one of the biggest things our office in Mecklenburg County focuses on those policy systems and environmental changes. So we want to make sure the right policies are in place and the right infrastructure to help these youth quit. So having those tobacco-free policies, having those prevention curriculums, having those alternative to suspension curriculums, so not only reach 1 or 2 classrooms, but the entire school district, right? Making sure those environmental supports are in with the signage and making sure they know if you're trying to quit, this is the quit line number, this is who you can go to, your counselor, your school nurse, and have these conversations. So it's our job to make sure that infrastructure is in place, those policies, those systems, and those environmental supports as well.
That sounds great. And I know you guys are working hard over there in Mecklenburg County on that. Michelle, this one, someone asked, what are the most common misconceptions around vaping that you hear from students?
There's a lot. I think the biggest one still to this day is that it's harmless water vapor and that there's nothing, wrong with it. And I think Dr. Chester can back me with this, but um, we know one that it's aerosol, as we've mentioned before. Two, your respiratory system is really meant for air, and these products are maybe approved by FDA for consumption via ingestion, which is completely different. And so, really having the negative impact that we don't know what that longevity is going to look like in the future. And two, that it's not going to do anything to them. Unfortunately, a lot of our youth have kind of that invincibility complex too, that nothing's going to go wrong with them or harm them with these. And again, we just don't know what the long-term effects are going to be. But the things that we're seeing now, and again, we've said it, are really, really alarming.
Yeah, and we got time for one more question. I'm not sure who wants to take it because there's some people, you guys all have kind of touched on this, but there's a question about what are the common marketing ploys that you see these vaping companies using to target youth? I know, Irene, you talked on it a little bit. I didn't know if you wanted to take it or Michelle or Dr. Chester, but if somebody could just briefly touch on that real quick.
Well, I can start a little bit if anyone wants to jump in. So yeah, it's those misleading health claims that it is safer, it's a stress reliever, it's, like some of these vitamin vapes, essential oil diffuser vapes, some just these other ones, the way they market it with the colors, right? So they make it bright, they make it vibrant, with the packaging, the way they make it fit in your hand very nicely. These are all kind of little tactics to make it easily concealed, easily kind of discreetly to be used within schools, within workplaces, where have you. So those are all different ways that they use their marketing, their promotions, the way they design the product to make it all work for, getting potential customers.
And I'll jump in. The flavoring, really, the flavoring isn't just, there is cherry and vanilla, but there's also like Fruit Loop and Tutti Frutti and, banana cream pie and cinnamon. So these products are definitely through that being targeted to youth as well.
That sounds great. Thank you guys so much. This is a topic I know that we could probably go a full hour on, but we don't have a full hour. But the great thing is we can keep this conversation going offline. Before we conclude, we also want to make sure that we do share the important resources that we have talked about during this session. So the American Lung Association is committed to supporting those impacted by all lung diseases. We are proud to partner with organizations like Novant Health to bring awareness into general lung health. So for more information, please make sure you look at all these resources that we have on the screen for you. So, of course, like we said, this has been a great conversation. And if you've submitted questions that we were unable to get to, our Lung Association team will get back to you within the week and with an answer for your specific question. Once again, I want to thank the community, today's Community Connections, and I hope you found it informative. We also want to thank our presenting sponsor, Novant Health. We're grateful to our panelists as well for their insight and their service. Dr. Mark Chester from Novant Health, Irene McCarthy from Mecklenburg County Public Health, Michelle Mulvihill from Wake County Public Health. Please join us at our next upcoming turquoise tasting event in support of the American Lung Association on October 12th at Carmel Country Club in Charlotte. Save the date. The Fight for Air climb is on March 24th. As always, there will be a post-webinar survey sent to your inbox. Please remember to complete the survey. Your feedback is important to us. Check your email for a recording of this session and additional resources. Once again, thank you and have a wonderful day.